Adolescents are always worried they're going to get too many pimples, and they hear this term acne. First of all, what is acne?
Acne is a rite of passage. It's more of it starts with whiteheads and blackheads, clogged up pores, and then they go through inflammatory lesions, which are pustules, and then they can get really big cystic. However, it's basically probably a post-World War II problem. And
Well, what's the cause?
Diet.
You think it's diet?
Guaranteed.
Okay, relax. If you thought it was diet...
Let me tell you why it's diet.
Okay.
Okay. The official studies go back about 30 years. They did carob versus chocolate, and there was no supposed distinction between carob and chocolate. So this is based, the last 35 years has been based on carob versus chocolate. However, if you go to northern Alaska, if you go to small islands like the Solomons, there's zero acne.
Really?
Yeah. So if you go to a place where it's a non-Western diet, where they don't have abnormal hormone spikes, so it's not environmental, it's dietary. Now, one of the things in terms of nutritional supplements that's been shown going back 35 years to help acne is zinc. So zinc, 25 milligrams twice a day, has an anti-inflammatory effect. And if you add vitamin D and fish oil, that alone will calm it down in about 2 months in terms of the inflammatory stuff.
So like omega-3 and things like that would be good?
Yeah.
So, but if you were going to use any kind of medication, what kind of medication would you use?
OTCs are going to be one of three things, over-the-counter products.
Right.
They can't, by law, an OTC is an over-the-counter drug.
Right.
So their active ingredient is going to be benzoyl peroxide,
Okay.
salicylic acid, or precipitated sulfur.
Right.
So those work to some degree.
How does benzoyl peroxide work?
It's antibacterial.
So it keeps the skin clean and keeps
No,
the
it kills off the bacteria, so what happens is you have an overgrowth of bacteria, and that's causing an inflammatory change.
If they tried that and it wasn't successful, they went to you because they tried all these things, what would you do differently?
Depends who you're dealing with. You're dealing with a teenager if they'll stick to a diet and nutritional supplements. It makes a difference. I'm not big on using antibiotics anymore. The reason is it's the party line. Everyone throws everyone on antibiotics. And what it's doing is it's suppressing it, but as soon as you stop them, it comes right back. Now, the question becomes mild acne. I think the OTCs are okay. I think the prescription stuff works. And if you're going to RX, prescription, then it's going to be a combination of anti-inflammatories. Okay, so I go nutritional supplements, dietary changes if they'll stick to it, a topical retinoid, i.e. Retin A, Differin, Tazorac, to toleration. You can use an external antibiotic. I don't have problems with that, because you're not subjecting that, killing off the normal flora.
There's some combinations with benzoyl peroxide.
Benzoyl peroxide plus erythromycin, benzoyl peroxide plus clindamycin. There's topical sulfur preparations. And
They all work about the same?
It depends on the individual sensitivity.
So you have to sort of go back and forth.
You play in combinations.
Okay.
The other thing is a lot of times the acne's better because you'll see it's flat, but they're still red. Now the reason for that is because the blood vessels got dilated underneath.
Okay, go ahead.
That's not going away. So there is when you got to start thinking, depending on how much it psychologically bothers the kid, you're looking for a light chemical peel or microdermabrasion.
Okay, and what does those terms mean?
Chemical peel is you're putting some sort of medical strength weak acid on the face. So you're causing a shedding process to open up the clogged pores, plus to even out the color. So the issue is most kids will be reasonably clear 3 months or less. But if you run your finger over it, they're basically blackheads and white, maybe have whiteheads left, and they just got a red face. And the redness is the damage that's left. Now, from my perspective, they're clear. From their perspective, nothing happened because they can't perceive that this is just redness left after. So if all you do is keep on medicine, they're going to get ticked off. It doesn't do anything, and that's why Proactive has the sales it has.
There's a lot of sales.
Proactive's probably somewhere between 400 and 600 million bucks a year. They got at least 1 million people on Proactive.
That's benzoyl peroxide?
Yeah, except here's the issue. The pharmaceutical companies are idiots, and I'm being serious. I told them for a number of years, you have X amount RX market, and you guys just basically keep rearranging chairs on the Titanic, and you're chopping it up into little tiny pieces. Right. Same garbage, they just basically change formulation slightly.
So all that kind of benzoyl peroxide is
No, it's not as good as the script one, but the script one contains something. But I think...
What makes a prescription benzoyl peroxide?
Because they throw an antibiotic in with it. Or
Okay,
they change
but benzoyl peroxide prescription and non-prescription will
About
be
the
the
same.
same. So the advantage of the prescription is adding the antibiotic.
Yes.
Okay, but many times just over-the-counter works well.
It can start to work. The problem is that day to day it's very hard to see changes in yourself.
And
It's really
sometimes-
hard. It's very hard to see objective
Sometimes
changes.
you go in and you clean up some of the
Yes,
bolus.
you do that. Now, older women's a different issue. Okay, women, even girls, it's a spike in hormones. Okay, so do you have a menstrual flare? All right, do you have a jump in hormones? If you have a jump in hormones, I'm very big against putting them on birth control pills, because if you put them on birth control pills like Yaz, it's officially approved as a preventative for acne. The problem is you now committed a kid to birth control pills. It'll take 3 months to kick in, and you have to stay on it for months and months and months. I personally, if it's a really, really bad case in a kid, 5 milligrams of prednisone. It's a really tiny dose. It's exactly what the adrenal puts out, the gland above the kidney that makes the hormones, and have a slightly suppressive effect on the abnormal ovarian adrenal hormones, and even out that hormone spike.
Now, so basically, a good diet,
Nutritional
omega-3, zinc is very good,
vitamin D.
benzoyl peroxide, and that probably, if you talked of 100 kids, how many kids we think would do well by that?
Physically or psychologically? Physically, I think half would do okay.
But the other half will probably end up a little bit more with a prescription antibiotic.
Yeah, because a lot of it is perception and age and the rest of it. The girls can have it worse. Then there's a whole other subgroup. The subgroup is look at the parent.
Okay.
If
Now,
the parent has scars, then the parent has cystic acne. Now that's the subgroup who has bad acne. And you'll see it, and the parent will bring that kid to the dermatologist